Let's get started. So welcome to the Fall 2020 Health Careers Week first professional panel. We are having a second professional panel starting at 5 for those of you interested in a broad variety of career paths, so feel free to go in between the two of them. But to start off with, I'd like to welcome Ms. Christine Skujins, I'm sorry if I pronounced that wrong, I should have checked with you, pediatric occupational therapist with Montgomery County Educational Service Center, Mr. Andrew Naylor, physical therapist with Bellin Health Systems, Dr. Mike Brown, Associate Dean from Concordia University School of Pharmacy, and Dr. A.J. Olszewski, Assistant Professor of Speech Pathology and Audiology here at Miami. So I want to thank you all for volunteering your time. I know that you're probably busy with work, and I really appreciate you wanting to help our students. The way this will work is I will start off with a few general questions, but students, I do encourage you to type your questions into the Q&A, and we'll do our best to get to all of the questions before the end of the event. Panelists, what we'll do is for the first question, I will call out your name in an order for you to answer. And then from then on, if you just want to keep that order so that we can, keep organized. So let's go ahead and get started with our first question. If you wouldn't mind describing your profession, we'll start with
Sorry, who are we starting with?
Mike Brown, sorry.
Great, thank you. It muted right as you said we'll start with, and then it was muted there. Hi, everybody. Thank you, Tylen, so much for putting this together and for inviting us. Just a great opportunity to be with all of you. From a describing pharmacy, so just a bit of a background, I'm a clinical pharmacist by training. And one of the things that I always like to start with when we're talking about pharmacy is that it's very common and certainly an important part of the profession to talk about what retail pharmacy is. But most people who understand pharmacy or think they understand pharmacy have had that exposure with retail, but not the full breadth of what pharmacy is. So when you think about pharmacy, I would really encourage that you're thinking about any role that has a high medication use within the therapy that we're providing for patients. My role as a pharmacist is as an ambulatory care pharmacist. So in my clinical practice, I actually have been a pharmacist for 20 years, but haven't dispensed a medication for about 17. But I work with patients on a weekly basis. So even though I'm in academia and teaching, I'm still seeing patients and working with them in a tobacco cessation clinic, where my job is to help them stop smoking. And while we use medications for that, my job is not dispensing. It's education, it's training, it's behavioral therapy. If you think about what a PA or a nurse practitioner does as a clinical pharmacist, I have that same role. So that profession really then becomes whether it's inpatient within a critical care unit, serving COVID patients, or whether it's outpatient within a clinic like my example, or whether it's within CVS or Walgreens, or within industry, within the FDA. It really is about working with patients in a way that helps them get the most out of their medications and to minimize those side effects they may be having. The profession really very much is focused on improving patient outcomes through the use of medications, and that can include both working with other prescribers and even serving as a prescriber yourself through collaborative practice agreements.
Thank you. Dr. Olszewski?
All right, hi everyone, and thanks for the opportunity to present at this again. I think this is my third year doing this. I am a speech language pathologist, and I'm a professor here at Miami. I teach the Intro to Speech Pathology and Audiology course. So those of you who have any interest in learning more about the field, I will probably be your professor for that class. So speech pathology in general is a very broad field. You can work in a lot of different settings. My clinical experience has been working in the schools. So I worked as a clinical speech language pathologist for a few years in Cincinnati Public Schools. I worked with kids from preschool through high school who had difficulties with speech sounds, who stuttered, children who had developmental language disorders, autism, all the way up through high schoolers who had difficulty with reading and story comprehension abilities. So it's a pretty wide range. Speech language pathologists work in inpatient hospital settings, outpatient hospital settings, private practices, and we're pretty evenly split. I would say that about half of speech pathologists work in some type of school setting, and then the other half work in some type of healthcare setting. And it's pretty common for people to do both. So to work in the schools and then work PRN on the evenings or weekends at a skilled nursing facility or at a hospital. We treat people who have speech disorders, so things that you would commonly think of with speech pathology. You have difficulty saying the R sound, or you stutter, to things that people don't think of. So speech language pathologists diagnose and treat swallowing disorders. So for older adults or people who have some type of neurological impairment, who have difficulty with feeding or swallowing, speech language pathologists would be the one to diagnose and treat that. We do combinations of feeding therapy, behavioral therapy, and working with physicians on different medications that might help treat swallowing disorders. We work with adults who have voice disorders as a result of vocal fold paralysis or a progressive neurological disease like Parkinson's disease. So really we run the gamut from birth all the way up through late adulthood. We work with dementia patients, stroke patients who have language impairments. We do a lot, and it's really a combination of assessment and trying to figure out the root cause of someone's communication impairment, and then treatment. So, whether that is some type of behavioral treatment or changing the environment or working with your physicians to develop a more medical treatment-based plan. We really run the gamut. I'll just give a quick plug for audiology, since I kind of represent that department as well. Audiologists, I think most people think of as administering hearing aids, which is a huge component of what they do, but they also do training on communication strategies for people with hearing loss, hearing screenings for newborns and infants to try and recognize hearing loss early on to prevent these children from having future speech and language disorders. And they also diagnose and treat balance disorders. So, the balance system is in the semicircular canals in your ear. And so audiologists are trained to treat that as well. Thanks.
Okay, thank you so much. Christine, would you like to go next?
Sure. Okay, here we go. So occupational therapy is, there's several definitions of it, and I think, how do I pronounce it? Our Mr. Olszewski discussed a little bit about how much your profession can be used throughout the entire lifespan, and occupational therapy is definitely in that realm as well. So it's basically just the study and application of human occupation. And when you think of occupation, it's not, a traditional job setting like you would normally think. It's more just your daily activity, that you're doing throughout the day. So eating, dressing, bathing, going to school, going to work, those types of things. So occupational therapists are looking at how people can do those better. So say you have a brain injury from a car accident, an occupational therapist can be involved at the onset in the acute care setting, helping them bathe, helping them dress, giving them support on that kind of level of either just from a rehab setting, also to adaptations that they could use that would make it easier for them to do those things. Moving into like an outpatient setting from there, occupational therapists might be involved with like driver rehabilitation, just trying to evaluate their cognitive status and visual status and all those things that are involved with driving. Are they able to do something like that? Are they able to manage their finances? Are they able to cook a meal? Things like that throughout their daily life. There's lots of other settings that occupational therapists work in just to analyze that kind of common human behavior and occupation. So schools, which is where I am right now, and it's my favorite place. I've been there for 10 years working in the schools. Hospitals, outpatient rehab, hand therapy. So occupational therapy also has that kind of connection to physical therapy where if you like that piece of the physical rehab, occupational therapists do a lot of splinting and any kind of trauma to the upper extremity, such as burns or, fractures and things like that as well. Occupational therapists are also in mental health settings. They're also in community settings. I've worked in developmental disability kind of campus in Chicago where I led a cooking group to some residents that had Down syndrome and just different levels of functioning. So just trying to make them more independent in their world. What else? Oh, skilled nursing and also geriatric, which right now is, excuse me, has always been a big plug for OT in the geriatric setting because there is such a need for helping the elderly get through their daily life after knee replacements, after hip replacements, all of those type of things as well. So, based on whatever deficit they're having, you're kind of doing like a task analysis of what do they need to do to function from the beginning. You do your evaluation, what's going on in their lives and what do you need to fix. Say it's a person who has Parkinson's and they're having a hard time eating, you might recommend a spoon that's weighted to help them kind of control their eating and their motor plans. So there's just a lot of different applications as far as how you apply that to the general population. In the school, you might have a student with autism and you might have to design kind of a sensory program for them to calm down in a corner or with headphones and things like that, and kind of using those sensory systems to help guide you in your treatment to help them function in the school. So I think that's basically what I've got.
Thank you so much for sharing. Dr. Naylor, would you like to go next?
Hi, yep. Thank you for having me, by the way. This is awesome. So I'm Andrew Naylor. I'm a physical therapist, and I'm currently in Wisconsin, but obviously proud Miami grad. Physical therapy really mirrors a little bit of what Christine and AJ and Dr. Wozlowski talked about with speech pathology and occupational therapy. We are part of that mix of allied medical professionals working in many cases as part of a multidisciplinary team. I'm currently in orthopedics and sports medicine, so I work closely every day with physicians, nurses, physician assistants. We have wonderfully talented occupational therapists downstairs who do hand therapy, as Christine alluded to. And we also have the opportunity to be an autonomous practitioner and work independently and run our own clinics if we're so inclined. So there's a little bit of a business side or private practice side to physical therapy. But regardless of what area you're in or what your specialty is, whether it's neurological PT, geriatrics, pediatrics, orthopedics, women's health, really what we're doing is we're always coming to meet with patients. We're evaluating their overall physical function, and we're meeting them where they are and trying to go on their journey with them to restore function in their life. So whether it's a high school athlete who tears their ACL, which is super common, and there's probably 5 kids in the audience today that probably have had that issue, whether it's something common like an ACL injury or an ankle sprain, or something much more severe like a traumatic brain injury in the neurological setting, we're getting that patient, we're meeting with them, we're evaluating their function, both mentally, physically, emotionally, and seeing where they are and where we can get them to. And that's really the crux of it. So there's lots of, like the other healthcare providers that are here today, there's a lot of different venues you can work in and a lot of different types of clinics or hospitals or healthcare wellness type facilities. But at the base of it is trying to meet that patient, try to understand who they are, what their limitations are, and how to overcome those limitations. So my job's easy because you guys covered a lot of my stuff, so it's good.
All right. right, thank you so much. I think that brings us to the end of our first question. So the next one is going to be, what did your professional education look like? Dr. Brown, would you like to start?
Sure, absolutely. Thanks, Sally. My professional education, so I'm going to describe it relative to what happens now with just a little caveat to start. So I'm old enough that I have a bachelor's in pharmacy and was able to be a pharmacist before I got my doctorate in pharmacy, which is not how it works now. So if you're going into pharmacy, it's one of the doctoral degrees that does not require a bachelor's degree before you go into the doctoral program. It's not uncommon to have students have a bachelor's degree, but the educational path is typically after high school, somewhere between 2 and 4 years of undergraduate coursework, but most of the time it's 3 or 4 years. And that those studies include certainly chemistry, but I would also be very quick to say that biology is at least as important, if not more important. So much of drug action is about the cellular processes and those biological processes in the body. So chemistry is important, but biology is arguably more important. And there's a lot of other coursework in there too, including things like calculus and statistics and the like. Within the Doctor of Pharmacy program itself, across the country, it's either 3 or 4 years. The only real difference between those two is in 4-year programs, the summer is off for people to be able to recharge and rejuvenate. And in that 3-year program, the summers are another semester. So it has the advantage of getting folks done sooner and at the same time showing some bias. I would say it also has a high potential to burn people out. So 3-year programs certainly aren't for everybody and may not be the best plan from a well-rounded person standpoint. That 4-year education, it includes both classroom-based learning, it includes lab-based learning, and it includes experiential out in practice. I think that's going to be a theme across the board for lots of the folks that we're talking with here. That education is really, that experiential education is throughout all 4 years, but it really culminates in the entire last year of being out in practice, caring for patients in all the settings that we talked about. If maybe this comes out a little bit more, but from that educational structure, who's most successful in that area, I would be very quick to say that while chemistry, biology, math are all super important, much like what the other professions are likely to comment on, being a good person at building relationships, being a good communicator, listening well to your patient are some of the most important attributes. Individuals who want to be there for others, it really is important for being a pharmacist. Certainly, you have to be good at biology and chemistry too, right? But relationships and the ability to be that humanistic side of a provider is really one of the most important things, and we work on that within the curriculum as well.
Yeah, I'll talk about education for speech-language pathology. So right now, the current requirement to be a licensed speech-language pathologist is having a master's degree, and that's almost always done in a 2-year program. Your undergraduate curriculum, you generally would major in speech-language pathology, but certainly graduate programs will take students from a variety of fields. In our graduate program here at Miami, some of our best students have been from fields that aren't even super closely related. We've had voice or theater majors who've switched into speech-language pathology. We've had art majors switch into speech pathology. More common fields would be things like psychology or nursing, and those students decide to go into speech pathology or education majors. The undergraduate curriculum is going to be pretty similar to most of your arts and science curriculum. We would recommend that you would take some chemistry courses, some biology courses. You would do some math, and then really focus on those communications courses. You'll usually take some psychology, some lifespan development. And then as far as getting into graduate school, I get a lot of students who ask or maybe are intimidated by graduate school, but I think what's just as important as the classes you take and the grades that you get is your involvement. in your undergraduate curriculum. We want to see that you're engaging with different organizations, that you're social, that you're getting along with other people, that you're taking on leadership roles. So that involvement piece is really important because this is a field where you're going to be working with people a lot. We want to know, are you a good student, but then do you get along with people? You can have a straight A student who doesn't have any people skills, who's not going to make a very good clinician. They might make an excellent researcher at some point, and that would be great, and we would help you find that career path. But if you wanted to be a clinical speech pathologist, that's probably not for you. With the master's programs, it is still somewhat competitive. It used to be very competitive simply because there weren't that many master's programs in speech pathology. But in the past 10 years, the number of programs has almost doubled. And so it's not as competitive as it used to be. The programs generally range from, so they're almost always 2 years, unless you've majored in something else in your undergraduate program, then you might take a year to get caught up in some of those undergraduate courses. Some students do that online now, so it might not take as long. You could do it in the summer or during your semester breaks. And then some programs are 5 semesters, some are 6. It really just differs based on whether or not you go for that final summer. It's usually the same amount of material. So if you're the kind of student who just wants to get done, you can go for one of those 5-semester programs. That's what we have here at Miami. If you want to take more time, you don't want to feel as rushed, maybe take a few less credits each semester, which might be better for your mental health, we would recommend one of those 6-semester programs. But in the program, you're going to do a mix of coursework and clinic experiences. In your undergraduate program, you might get some clinical experience. At Miami, we've been fortunate enough up until COVID started to be able to get almost all of our students some experience in our campus clinic. So they're going into graduate school having worked with a client or two. But in graduate school, half of your time is going to be spent working with clients either in a campus clinic or going out into the community, into skilled nursing facilities or hospitals or schools, and seeing clients there where you're under direct supervision. And then once you graduate with your master's, you do have to complete what's called a clinical fellowship. And that's going to be it's a 9-month position. And that's where you're working, you're getting a paycheck, it's a job. You just have an assigned mentor who is checking in on you twice a month to make sure that you're doing okay and to see what questions you have. And so you've got some mentorship support for that first year working in the field. So, as far as schooling, you can get the master's program done in 2 years. You don't get your official license until you've done that 9-month fellowship, but you're almost always getting paid for that fellowship. That's all I have.
Oh, hi, and I wanted to say thanks again for inviting me. I forgot to add that to the last piece of my talk, but very exciting to be here, especially being a Miami grad myself. I'm married to a Miami merger, hence the office of all the Miami apparel behind me. So always fun to get back to Oxford and chat with fellow Miami students here. So my path was a little different. So for me, I graduated Miami in 2004 as exercise science major. I always thought for sure I was going the physical therapy route. Everything was physical therapy for me. But there was one point in time when I had observed an occupational therapist in the Detroit public schools. And I always kind of kept that in the back of my mind. And I always thought that was pretty cool what they were doing there. And I really liked that. It was a family friend. My brother also had a spinal cord injury, which also kind of led me into the physical therapy piece. So I was kind of going through both. I did a lot of volunteering while I was at Miami at like McCullough Hyde and the outpatient places I could find in the summer, just to try to get my foot in the door and just try to get learning, just learning different things about clinics and people skills and all that kind of stuff. So I would definitely recommend doing some of that, although COVID is tough right now, but that does help, definitely, like a lot of people have been saying, just to have those people skills in place, especially with pediatrics right now, where You have students of all kinds of levels trying to get back to school, different disabilities. You really have to have a calm demeanor and a good ability to work with kids and be flexible to their situation. So, and then I went to Grand Valley State in 2004, and then graduated 2007 with my master's in occupational therapy. So a little switch. I had kind of applied to the doctorate PT program, got in, and 3 weeks in, I thought, I don't know if this is for me. Like, I thought I did all the research. I thought I figured it all out. I knew for sure. And then it was kind of like just hit me in the face that I just don't think, like, all of this physical rehab, it was so much physical stuff that I didn't have enough of the psychological piece into it, things like that. Some of that more flexible piece of science, I guess, that I was missing. So anyways, they decided to accept me into the OT program. So I transferred into that. My parents were thrilled. No, not really, but they came around to it. But, you know, I guess that's my point, to say that you don't always know right now what you want to do, because, you know, I even got to grad school and said, I don't want to work with kids. I don't want to work with kids. And then now I've worked with kids for 10 years and I love it. So it just takes some time to, I guess, filter out what you're good at, what you like, and how life kind of plays out for you. But don't feel like you have to get stuck in a pigeonhole of things, you know, just try to keep your options open for that. So just graduated, and, you know, right now I know there's a master's program and there's a doctorate program for occupational therapy, and I'm not super well-versed in saying which one is better, which one is, you know, going to be the right choice for you. Just, you know, go ahead and do your research on that. But I know Ohio has different schools that offer those options. So I've had students come from University of Findlay and do their level 1 field work with me. It's just a week-long experience, just working with me and learning how OT works in the schools. And then OTs, when I went to school, we had it was like a 3-month kind of rotation where we did, I worked on a stroke team at a rehab hospital, a brain injury rehab center, and an acute center. So yeah, there's lots of applications after you graduate too. So, you know, there's a lot of things to do with OT, and my career has kind of led me to all those things. When I graduated, I was working at Athletico in Chicago in hand rehab. So then I kind of did a little flip and did more physical rehab. Then kind of went to that more route of developmental disabilities in a campus setting, and then just worked in schools. I've been in Dayton Public Schools, West Carrollton, Dayton Charter Schools, Coleraine, Northridge, Valley View right now. So also behavior schools. So there's ESCs, which I'm a part of. So we're kind of a support center for schools. So if, you know, schools are saying, okay, we have this child who has needs a vision evaluation, you know, they'll reach out to the ESC, and we have services that are going to support. Same thing with autism. If a student has autism and the district is having a hard time working with that student, they might have the autism team come out from the ESC. So I'm a part of the ESC right now for OT and PT. There's about 80 of us here in Montgomery County, so at the ESC here. So, but you could also work at a local district as well for schools.
So physical, Christine, you brought up some also some great points that are very similar to what physical therapy is as well. And I'm also an 04 grad, so we were there at the same time. I thought your face looked familiar, but it's been a while. Our professional education path for physical therapy is pretty similar in the sense that you'll need an undergraduate degree. So if you're here right now, you're already on the right path to get that. I can think back about a number of things where I spent my time incredibly valuably at Miami. And I can also think of some things I did probably wasted a lot of time. Job shadowing and observing, whether it's summers at home or while you're on campus at a place like McCullough or McCullough Hyde, is, you know, it's critical, because whether you like the concept and the theory of your profession or one of these professions, to be there and be with somebody all day long, be with patients or be with clients or students and see kind of how they respond to you and how you like that interaction day in and day out, and becoming, honing yourself into becoming a good people person is pretty critical. That part was kind of always easy to me. I always really, really loved being around people, and that's one of the reasons why I picked the profession. As I've been doing it though longer, I do sometimes wish I had a little more quiet time in my day. But my path through Miami was pretty similar. I got an exercise science degree, spent 4 years doing that, got out on time, and I ended up going to Ohio State for the Doctor of Physical Therapy program there. When I applied, the master's degree graduate programs were transitioning into doctoral degrees, or DPTs, which is a clinical doctorate. My mom still tells everybody I'm a doctor, but it's a clinical doctorate in physical therapy. It's different than a medical doctorate. And we also are and physical therapy also is trying to follow the medical model of education, similarly to the speech fellowship, it sounds like, where we offer 1 year, coming out of physical therapy school as a doctorate, you're considered a generalist. You're competent enough to treat all things, but you're probably not expert enough in any one thing to treat it really, really well, or evaluate and treat it really, really well. So our field has developed residency education, and that is something else that I did after Ohio State to earn a specialty and a little bit more mentorship and expertise in one field. So I went from Miami in 4 years to 3 years at Ohio State to earn my DPT, and then spent I got a job in the hospital system as a sports physical therapy resident, where I was able to treat in the clinic about 30 hours a week, spent some time being a TA in the orthopedic physical therapy labs, and then I covered college rugby and high school football. And if you want to learn about sports medicine injuries, there's no better place to spend time than with the rugby team. They get hurt in a number of ways, both on the field and off, and that was a lot of fun. And that led me down the specialization road into sports and orthopedics. Most physical therapy schools require anywhere between 40 to 200 hours of observation prior to getting in. So highly recommend that you get those venues, or get the hours in those venues that you can. And definitely spend a little bit of time in each. I spent almost no time in pediatrics, and I wish I had. But PT school, you need the observation hours to get into school, and the job shadowing and the observation hours really will help give you a sense if you're on the right track, if you're wondering if PT really is for you. And then once you're in PT school, you'll do, of the 3 years of PT school, about 15 to 16 months as clinical rotations. And that was mentioned, like field work and internships and things, but clinical rotations where you're practicing and treating patients under the supervision of someone like me. And then for me, a residency was, you're a paid position. You're a licensed physical therapist. You're just paid at a slightly reduced rate because you're getting some more education. And that's how the residency program works. But yeah, that was my career path. And then one thing that I think all of our professions require is to maintain your competency and maintain your active license. You'll always have to do some amount of continuing education classes while you're professional to stay fresh, and that's great too. So these professions are all ones that need a mind who wants to be a lifelong learner. So yeah, that's kind of how I got to where I'm at.
Great, thank you. Those were all really great answers and really helpful. We do have a couple questions that came in from the student attendees, so we'll start on those. Research has become an important prerequisite for many professional schools. Would you say this is more important than clinical experience or shadowing? And do you think that they should go hand in hand?
So I can certainly start with that one, and Tyler, just let us know if you want us to all go around, or if you want us to take these, as they fit within our professions. I think that the panelists so far have really done a really nice job of accentuating how important
I would just echo what Mike said, that it's critical to have a balance. And I can tell you that when I don't know if this was, I really can't remember if this is something that this was my own fault or it just wasn't really a great opportunity that I had because of the way the exercise science department was when I was coming through. But I can tell you that as the last 10 to 15 years have gone by, more and more students have the ability in undergrad to help out with a professor who runs research in their lab. And they may not get published on an article, but they at least have the experience of research, and that's very valuable. Everything in physical therapy is really pushed to be evidence-based practice. So the old days where people got hot packs and ultrasounds all the time is way gone. And as insurance clamps down on what they want to pay for and what they don't want to pay for, things that have good evidence behind them or have well-published research studies that promote their efficacy in clinic, whether it's a neck manipulation or whether it's a type of stroke rehab, it's important that young students, A, understand the research method, which is applicable to all fields, B, can apply that research to or apply that understanding of the research method to what they're reading to support their practice. And then, again, clinical experience and shadowing is highly important, but understanding that the research side is at least a critical component. And for you younger folks who are trying to get into school, you need letters of recommendation to get into all these programs. So if you spent extra time in a researcher's lab, there's someone that may be able to write a rec letter for you, and that's pretty important. So.
Yeah, I agree a lot with both of your comments. So I actually serve on the admissions committee here at Miami for the speech pathology program. And I mean, research is absolutely never going to hurt you. It's going to look good. It's definitely going to help you develop those relationships with your professors to get good letters of recommendation. So each January I read through about 300 letters of recommendation, and most of them look pretty identical. I can tell when a faculty member has a good relationship with a student and those letters are more meaningful. That being said, there are plenty of students who don't do research who absolutely get into graduate school. I would recommend that you do something to stand out. But like Mike said, getting that clinical experience is so important to know that that's what you want to do. I mean, this is a lifetime commitment that you're making. So you want to make sure this is the right program for you. Would I say that one is more important than the other? Probably not. But certainly knowing for sure that you're passionate about this field, that speech pathology is for you, that's going to be important. And part of the way that you can prove that is by saying, you know, I've observed or I've gotten some clinic experience in these different settings. And so that has reaffirmed my passion for this field. Now, if you want to show that passion for the field through research, that's great as well. You know, so basically, I would say definitely get at least some observation hours. If research is for you, go for it. Like Andrew said, there's a huge push now for evidence-based practice. So absolutely, you're going to need some understanding of research in grad school. So it can't hurt to get that early.
I'll jump in quick too. When I'm using research in my therapy, you know, usually that will come through my continuing education that Andrew was mentioning that we all have to get credits for. So that's usually how I'm getting that information of what's changing and what's new or what's interesting to me that I want to plug into. Because, you know, the day-to-day, you know, you're seeing 10 students a day, one by one, you've got requirements from Medicaid, you've got to write the perfect things in your notes. You have to have that. You have to have the teacher coming in down the hall saying, you know, this person needs something or wanted to talk about this. So it's a very dynamic environment throughout the day. So I'm not usually just sitting there and saying, oh, I wonder what, you know, I could think of today to research, you know. So, you know, we're getting it in different ways. It's being filtered different ways. Sometimes I get it through students that come through in their rotations, and they'll usually have an assignment where they have to provide me with a recent article. So I'll check into that or something. But I do think having the experience in grad school for, you know, writing a thesis like I did just helps you kind of just learn the whole process and be more understanding and able to read and filter through some of that information. Is this a good study, a bad study? And especially now in our current global pandemic, you know, even being able to filter through studies right now of, is this just a bogus study on Facebook that everybody's throwing out there? Or can you really like read through the lines and say, you know, oh, in my research class, I kind of learned that this, you know, we need to look for this double blind or things like that. So I think it's necessary. I don't think you're using it day to day consistently, but you're using pieces of it, filtering in throughout your practice, at least in my case anyway.
Great, thank you. So we have a couple more questions that have come in from the students, and they are for everybody. But I mean, like I said, if you don't feel like you have anything in addition to say, you don't feel like you have to answer everything. This one I think is a great question though. Each of you work closely with patients. How has COVID-19 affected your ability to work closely with patients? Do you feel this experience has taught you anything important? Mike, you can start again.
Thanks. So I'll be brief because it may well be that some of my colleagues have a little bit more hands-on. There's a fair amount of pharmacy that actually can be done using whether it's Zoom technology or FaceTime and I certainly have strong relationships with my patients and don't have any problem providing care over the phone or over technology. What I would say it's taught me both as a clinician and as a human being is, you know, we're made to be social beings that we really benefit from high fives and hugs and seeing people's faces and seeing reactions. And probably the hardest part of practice is that when you're in an environment that's not using technology and that mask is there, not being able to see somebody's nonverbal cues to what they're understanding from an education standpoint or see their nonverbal cues for how they feel in terms of their, whether it's pain or whether it's, you know, angst over their condition or what they're hearing about it. That's probably the part that I would say has been the hardest. It's amazing. We don't frequently talk about how many cues we take from nonverbal patient interactions. And that's been something that we certainly, you know, the technology has been able to help with. But when it's not there, you really got to work hard to make sure that the verbal questioning and the verbal responses are solid because you don't have that extra nonverbal to work with.
Yeah, for speech pathology, I don't work too much clinically anymore. I do some work in the schools, but I know with our clinic on campus, almost all of our clients now, we're just doing telehealth with them. So basically what we're doing now, meetings over Zoom. But you do lose out on a lot of, building that rapport with your clients and a lot of the nonverbal cues as well. So it's really difficult. Obviously, some patients you're not able to see over telehealth, and there are plenty of SLPs who are still delivering some in-person services. But I think right now, to the extent that it's appropriate, we're trying to move as many people as possible into telehealth just to reduce the risk of spread.
Our lives in the school have been altered like 360 times 1,000 here. So, when everything shut down, we moved to the telehealth piece, and you've got parents that are, trying to parent and work at the same time, which was me. And you have to recognize that from your families as well. Some of them didn't have printers, so you can't send out information to them. You have to drive it to their house or mail it. And then certainly when you go to their house to deliver the materials, you notice a cat jumping out the window and different things happening in these houses that you would have never really even thought of. That, like, do they even have a bed to sleep in? Like, how do people live in this house? They do. And so I think it certainly gives you a new perspective on where your students come from, and that dynamic is huge to learn a little bit more about them. So I would say that's hard. And then as far as in the school, day to day, they're telling us, try to keep that 6 feet distance as much as possible, and try to not be with your students as much. And that's hard. I mean, they're small children. I don't work as much with preschool, but I'm second through high school. But they all have different levels of needs. So to look at their handwriting, I can't necessarily work with them 6 feet away on this. So I'm pretty much in that bubble most of the time. And it's just that's kind of the way it has to be for the most part. I mean, we do our protocols, we sanitize all of our equipment. I sanitize every pencil. I have a dirty bin where I put everything in that anybody has even remotely touched or used. A lot of it is throwaway stuff, paper and pencil tasks. I do a lot of ball tasks because those are easy to clean. As far as I used to do pegboards and light bright and all kinds of little fine motor games, but I'm not even going to try to start cleaning those every day. So, that's just, and then scheduling. Every parent I think is going through, what is this? They're getting 17 notifications. We started out in my district, we were 2 days a week in person. The other kids were the other 2 days. Now this week we're all 4 days, but 1 day virtual. So, it's just this difficult sea to navigate, but we're doing it. I feel like it's kind of cool in a way to be that kind of pioneer in a way of, we're going to be the people doing this, that we're going to be talking about 5 years from now, that we kind of withheld the storm. But yeah, it's definitely changed a ton on my end.
Andrew, anything you want to add?
No, they kind of all covered it. I'm definitely wearing a mask and eye protection, and we're cleaning everything. And we did shut down for a little while, but we were reduced staff to about 50% for the first couple of weeks of the pandemic, really the first 2 months. And then we've been able to come back to near normal volumes. What really keeps us going is that there are a lot of people out there that need, it may sound elective, but there are a lot of people out there that need rotator cuff repairs and total joints. And if a person has a total joint done by an orthopedic surgeon, they've got to get moving. They've got to get going the first couple of weeks afterwards. And so even though again we're allied healthcare professionals, we are essential workers to those in need. So yeah, it's kept us moving, but not without its challenges. Just fortunate that my little one is only 14 months old, so we're not navigating as much of the kid doing the schooling to our own children at home, thank God. So God bless you.
Thank you. Well, the question that we have next, how about we'll leave this just for the Miami alumni. Any academic regrets during your undergrad years or something you wish you could have done to further your career goals? And Andrew, we'll go ahead and start with you.
So I would say that I have developed, I'd say my biggest regret is that you will become such an expert, or you will get so much of the content that you need to excel in graduate school. You get a lot of it. I mean, you're in class, instead of being in class like 16 hours a week or whatever it is in undergrad, you're in class from like 8 to 5 in PT school. So you get so much content that you need in PT school that I wish I stayed awfully focused on what my plan was going to be, which was PT through undergrad, that I now wish I had taken a couple of business classes. I just wish I had diversified myself a little more in undergraduate, and then really honed in PT school. And I realize that sounds crazy, because you probably feel like, oh my God, all the prerequisites just to get into graduate school is so much work, which it is. But I just wish I had taken like an introduction to finance class or econ, or something that really helped me understand the way the world works. Like, and I keep going back to econ, because even though we're in healthcare fields and we all decided we wanted to help people, many of the things that dictate how our job functions on a day-to-day basis have economic, business, and socioeconomic related factors. And so I just wish I would have diversified myself a little bit more. And I will say that I don't want to say negative things about the exercise science field, but sometimes it can be challenging. I found it would have been very challenging for me to find a job if I didn't get into physical therapy school. I would have had a hard time marketing myself with my exercise science degree alone. And that's a very scary thing. And I don't mean to say that negatively. So I do, like, for me, had I known I was going to be had I known I was going to be a PT and go into sports medicine wholeheartedly, then it probably would have been more beneficial for me to get an athletic training degree undergrad, or a biology degree, or something that was a little more marketable if PT didn't work out. Luckily, fortunately, I got into almost all my schools and off I went. But looking back, I wish I would have diversified myself more.
Christine?
Yeah, I would agree with a lot of that. And I think we're grads at the same time, so we went through the same program. I do wish they had a little more of that business side too. I mean, so many OTs talk about opening their own practice and all of these things that are related to that. And I mean, I don't have a clue. So, I mean, I think a lot of that would have been a lot more helpful to kind of well-round the program. But in general, I mean, I feel like, like you said, when you get to PT school or OT school or wherever you're going, I mean, you're going to, be taught everything you need there. And, as long as you're passing your licensure, that's the big thing. You've got to pass that test. So as long as you're finding a school that has a good test pass rate, then, that's another good thing to look for in your school. But I don't really have any regrets. I mean, I feel like I probably studied more, like harder than I probably needed to. I probably could have just enjoyed it a little bit more. But I was so set on the end goal of graduating and getting into grad school that some of those really fun pieces of Miami, I kind of still was a little more studious than I probably needed to be, because now it's all work and kids and not as fun. But in some ways it is. But so I think just try to relax and enjoy, where you're at, and that everything will work out. I mean, like I said, I don't have any regrets of the way that my whole career path went. I mean, I kind of went through doors, some of them shut, some of them opened. I kind of just followed the maze and, arrived at where I eventually needed to be. So.
All right, thank you. This is a good one, I think, for all of you. Throughout your years of education, did you ever think about dropping out because of the amount of schooling it required in your field? We can start with Mike again.
Yeah, so that's a fascinating one. I would say that, well, the answer for me is no. It's a little bit more complicated because I did look at going to med school in addition to going to pharmacy school and getting my PharmD degree. And I actually chose pharmacy both because I really enjoyed being the medication expert, working with patients directly, and because of the time that it would have required to become a physician that was so much more than being a pharmacist. And I don't share that to pick on folks that say I'm pre-med and I know I want to be a physician. Just from my standpoint, what I've been able to do in my career in serving patients and serving students has been incredibly fulfilling. It uses every bit of my brain. The evidence-based medicine that we've talked about is part of pharmacy in addition to all the other professions. I've just really enjoyed it and have been able to have some really solid work-life balance as well that I think at least some of my physician colleagues have described being pretty challenging. So no, but if anything, I would say that it reaffirmed that I was on the right path relative to some other options that I might have taken.
Yeah, for me, not really. I came into college not sure what I wanted to do. I started and ended as a psychology major. I had decided I was going to be pre-med for a couple semesters, really struggled with biology and decided that medicine probably wasn't for me. And I had no idea what speech pathology was when I started college. I fortunately had a great academic advisor who said, you know, this sounds like it's for you. It's a helping profession. It's healthcare related, but not as hard sciences heavy. You know, you like interacting with people. So I took that intro course and fell in love, but that wasn't until the end of, I think I took the course the start of my junior year. So I was kind of scrambling those last 2 years to get all of the required courses done. Fortunately, there was a lot of overlap with psychology, so I'd taken some of the courses already. And then in my master's program, it was 2 years. It flew by. You know, it's like you blink and it's over. It's not easy. I'm not going to pretend that there weren't times when I was in it that I thought about giving up, but it wasn't because of the length of the program. It goes, I know at that age, 2 years sounds like a lot, but it goes so fast. And looking back now, you know, it really wasn't a big deal at all. So no, I don't think so.
Definitely had, I would kind of answer the question in twofold ways. I know I definitely had at least 2 or 3 days kind of sprinkled in through graduate school where I was like, oh my God, oh wow, like here I am, did I really make the right decision? And can I do this the rest of my life? And, you know, what I would think back to though, kind of like wrap my brain, like what else do I really, you know, every time I thought about what might happen or if there was going to be failure, or if this wasn't going to be for me, I started to sit back and think, well, what else do I really, really want to do? And I never felt as passionate about anything else as I did about this. So even I think some of those moments where you might say, oh gosh, you've got a little bit of anxiety, I think that's sometimes healthy to just check and see what you're going to do and rethink your plan and make sure the thought process is right. And then the other thing I would say is I ultimately think I would have made maybe been a C+ physician, but I think I'm an A+ therapist. One thing that really, really deferred me away from medical school was I didn't really understand the way medical education went, and that you essentially took out loans from medical school. But then once you're a resident, even though you don't make much money, you do get paid to be a medical resident and a medical fellow before you become a full-fledged physician. So I will say that on the flip side, I think I kind of thought PT was going to be more cut and dry, a little more work-life balance, and a little less difficult. And I kind of picked PT because I, thought that was probably the more appropriate skill level for me. But now that I work with orthopedic surgeons and physicians all day long, I absolutely could have done that job. I mean, I needed the training to do it, but looking and see what they do, I'm in the building before them some days, and some days they leave before I do. So I would say to follow your passion for what you really, really, really want, and don't let an extra year or two of school slow you down. Because if you really, really want to do something else, you're going to find that we're all working 8-9 hours a day. It just depends what you're doing for work. So keep that, keep that in mind. That don't let an extra year of school slow you down, but at the same time, a little healthy anxiety is okay.
I never really thought about, well, I did think about dropping out of PT school, but, and I did, but, it worked out okay. But anyways, I mean, when I was in OT school, I think the biggest thing that was difficult for me was being in like the more of the clinical settings versus the length of time of the program itself. Cause I was always really good at, writing. I was really good at sitting in class, answering questions, being a good student. But then when it came to that practical piece where I had to be out there and like applying what I was learning, that to me was the most anxiety provoking thing. Because all of a sudden you're in a room with a person who just had a stroke and you have to try to, figure out how to rehab and things like that. So I think that to me was the most difficult piece of grad school. But as far as, just keeping my eye on the prize kind of thing. And I knew for sure that I wanted to do rehab and help people. I mean, early on, I knew rehab was more for me than the actual diagnosis piece. I never really ever considered the medical side of, the diagnosis doctor piece. I just loved making that relationship with people and seeing that rehab process come through. So for me, it was just a little bit more of figuring out the details of where I fit better with that. But overall, I think if you want something, you'll make it happen.
Great, thank you. And actually, to kind of go off of that, I'm going to skip to this question. If anybody wants to say anything about this, did you keep an open mind going into professional school, or were you dead set on the profession you're currently in? Anybody who wants to answer, go on ahead.
Yeah.
When you say professional school, do you mean graduate school?
Yes.
So I might start with this, but for Lindsay, I'm actually going to change your question just a touch, because I think it'd be easy to talk about whether I had an open mind for pharmacy versus medicine or what have you. But what I would really encourage you to keep in mind is keep an open mind the entire way, right? It's not like it's great, there's one fork in the road. Am I going to be in PT or pharmacy or medicine or OT or speech pathology or whatever it is? Every step of your career is another opportunity to say, I've got an open mind for where this career can go. So that, once you're in pharmacy, for example, then you're thinking about, is it inpatient clinical? Is it inpatient dispensing? Is it outpatient clinical? Is it outpatient dispensing? Is it government related? Am I going to focus on oncology? Am I going to focus on cardiovascular? The choices never stop. And I think that when you talk to people who are most excited about the profession, it's folks who have found ways to continue to reinvent themselves within their profession, or at least be open to reinventing themselves. And when you talk to people in the professions that may say that they don't necessarily always love what they do, it's because they've said, so I started in this role and I'm still in that role and I've seen other opportunities, but I haven't gone after them. So just making sure you keep that open mind throughout the entire process. Picking your profession is only one of those steps.
I would agree. I would wholeheartedly agree with Mike in the sense that I think one of the fortunate things is within a lot of these professions, and nursing would be included, that there's a lot of different options you have within the profession. For example, I've worked for hospital systems. I've worked for a professional sports team. I've had some really great experiences. But the one thing I would tell you is that there is absolutely nothing wrong with taking a year or two in between undergraduate and grad school to help yourself sort this out, because at least for me, I had to take student loans out to go to graduate school. And once you're a physical therapist, like for me, I'm not really qualified to do anything else but physical therapy now. So I would say that you don't have to know exactly what kind of PT or speech pathologist or occupational therapist or pharmacist you're going to be before you get in. But unless you got a lot of money to blow on your first year of school, I would highly recommend knowing that you really want to do it before you jump in.
Yeah, I agree. I agree with knowing for sure when you're going in that it's what you want to do. And then once you're there, like Mike and Andrew said, there's a lot you can do with each of these fields. So with speech pathology, I went in thinking that I wanted to work with children who had language disorders. And it turns out that that's what I did. But along the way, I discovered that I really liked working with adults who had traumatic brain injuries. I learned that I enjoyed doing some of the modified barium swallow evaluations where you're having someone swallow different consistencies in front of the x-ray. Like I enjoyed that. And I think I would have been happy doing a lot of those different things. And I sometimes see students who come into the graduate program and they're like, I'm 100% sure that I want to work in a NICU when I graduate. And then they'll go through the program and they have trouble getting a job in a NICU, and they didn't let themselves enjoy any of those other areas of the field. And so they've kind of, gotten themselves into a little bit of a corner there. And I would just say, keep an open mind, and you're probably going to find that if you like one aspect of the field, you're going to like lots of different aspects of the field. And that might lead you into an interest you didn't realize that you had.
Yeah, that's a great segue into what I was going to say. I mean, I was like dead set on not doing anything pediatric. I wanted to do all outpatient brain injury. I loved that piece of rehab. I thought that was like fascinating, and I still do. And I just never really ever would have pictured myself as a pediatric OT. But, as time goes on and, your work choices change and your jobs and you move around and things, you find yourself in different situations. And like you said, I think a lot of people said it's important to keep an open mind and try something that you really don't think you're going to maybe even be good at, because 10 years in, I love it. I love going to work and seeing a lot of my kids, and, some of these kids, you're like the light for these kids. They, are living in home lives that, family members have, there's just so many crazy things that I come across in a day. There's children that are like wards of the state. There are, kids with so many different handicaps, but, a lot of those kids can just really teach you a lot of things about yourself. And I never really realized that going into pediatrics. I just thought it was a lot of just playing games and having to speak in a silly voice all day. I was like, I need something a little more serious, but it's actually very lighthearted and it's very fun. And, I definitely learned a lot from, and they teach me a lot too. So it's been really nice.
Great, thank you. So we have another good one that if everybody feels comfortable answering, that'd be great. What would you say is your favorite thing about your job and your least favorite thing about your job?
Let's go.
Go ahead, Andrew. You look like you're ready.
Say, yeah, I didn't know if we were keeping the same order.
We can switch it up if that's okay with you.
Yeah, I would say my most favorite thing is just knowing that somebody, like kind of like what Christine was alluding to, is just knowing that you're helping somebody, do the thing that they love to do the most. So whether, at one point in my career, it was, watching a guy on TV that I helped with his shoulder, and he was throwing 95 that night on TV. But with the average person, or a lot of my high school kids, it's getting them back on the field. Somebody telling me, "Hey, thanks for all the work you did. I was able to spend 2 hours in the garden over the weekend, and I pulled all my tomato plants, and I didn't have an ounce of back pain." So seeing people kind of get back to their life and enjoy things again that they used to not be able to enjoy, that's probably, that's always the big winner. So I love to see that little bit of competition or competitiveness that you have in yourself, helping push a patient on to success is kind of my favorite thing. And then my least favorite thing is just, there's a few things that with dealing with insurance companies and our documentation that we have to do on a day-to-day. Some of our day-to-day stuff is just boring as can be, and I hate to admit it, but it's true. And you just learn to, enhance focus on the positives and get through the negatives.
Yeah, I would piggyback off of that. I think that I'll start with the least favorite. It really is when medication decisions are being made by bureaucracy or insurance and not by evidence-based medicine. And evidence-based medicine is fascinating from it doesn't mean that, there's an article that says this is exactly what you must do for this patient. There's, that interface of evidence-based medicine and clinical practice experience that drives the decision point. And when insurance deviates from that, that gets particularly frustrating in the profession of pharmacy, and certainly, as Andrew describes, I think in lots of our professions as well. The best part of the job, frankly, is what I would describe teaching. And I want to make sure that I'm being clear when I say that there's teaching across all the different parts of pharmacy. But if you said, you mean, so like talking to somebody for 25 seconds in Walgreens, there's so much of pharmacy that's more complex than that. My favorite part of working with patients is describing disease states, helping them understand in their terms what the pathology is. How does that disease state actually impact their quality of life? Hearing from them what makes a difference to them in terms of their goals, and then being able to use the medication knowledge that I have, the disease state information that I understand, their goals, and put it into their language to help build a plan for them that changes the way they live. There's nothing better than having a patient come back, and Andrew really said it very well. So whether it's PT or pharmacy, right, that opportunity to have somebody come back and say, I worked with what you shared with me, what you taught me, what you helped me understand about taking care of myself, and this is what difference it's making for me in my life, right? Patients don't do what we want them to do because we tell them to. Patients do what we ask them to do because we teach them. And that really just is an incredibly gratifying part of the job.
Yeah, I'm sorry. I agree with Mike and Andrew. Absolutely, the worst part is the documentation, the paperwork, and when insurance or just the ability to pay for services is what's interfering with best practices. When you know that you could do something better, and because of that bureaucracy, they're not able to get that. I would say the best part of speech pathology is that I really don't see how you could ever get bored doing it. Every day is so unique. Even if you have a patient who you've been seeing for a long time, each interaction with them is going to be so different. You're going to be challenged. You're going to get all different kinds of patients. Particularly in speech pathology, they're always going to say things to you that are really entertaining. You'll get whether it's kids or adults, they'll say things that crack you up all the time. And I love it. I love making those connections. You're really getting to know the patients that you see. You're getting to see their growth over time. I just don't see how it could ever be boring, because it really keeps you on your toes.
So I agree a lot with the cons, with the paperwork side of things, government regulations, Medicaid, ODE, all of these pieces that are telling us what to do, and we want to do these things, but they're telling us other things, or we have to phrase things in a certain way. It just gets really tricky sometimes, especially in the school setting when you're working in an educational environment, yet you have to have this medical piece of things being medically necessary. So you have to go through all this verbiage to make sure what you're doing is correct. And, just these trainings on these things are just like boring. And, you just kind of wish that you could just get on with what you need to do in a day. But, all of those things, just keeping track of your licensure, regulations and things like that. All of that stuff is very important, but it's definitely not the most fun part for sure. I would also say just not having a lot of structure is hard. When we go in, we have to make a whole schedule for 45 to 50 kids. So, trying to find this structure is hard sometimes when you've got to schedule IEP meetings for these students. You've got to schedule other things. The parents can only meet certain times. So your day is consistently just interrupted by different things. So I would say that's the hardest thing for me to kind of work through. as far as like a school-based therapist. But, you know, the pros are definitely, you know, you do have flexibility with scheduling. You know, I can have the summers off right now, which is a huge plus. But even that, you know, you can kind of work through your schedule as an OT. You know, you can be part-time somewhere, you can be weekends somewhere. I mean, there's just a lot of different applications to that, you know, to fit your lifestyle and what you need to do. And definitely just that people piece, you know, I think it's a people-oriented profession. So, you know, not only am I working with a student, but I'm working with the teacher, I'm working with the parent. It's a big collaborative team. I'm working with the speech therapist, I'm working with the PTE, I'm working with the district rep. I mean, there's so many pieces, and I really enjoy kind of learning about the kids and how everybody kind of has the piece to the puzzle and we all kind of meet together. So.
Great, thank you for all of those answers. We have about 13 minutes left, so we'll get to the questions that we have, but that's probably going to be all we can do. Another question for everyone. Can you briefly talk about the coursework of your professional school? What did the first couple of years look like? And what does a typical day in your job look like? And we can mix things up and start with Christine.
Okay, so as far as coursework goes, I would say a lot of it was psychology classes, neuropsychology classes, human development, child development, you know, lifespan adaptations, you know, different, you know, ways to adapt, different activities. We had a learning lab where, you know, we had all kinds of different gadgets and things to learn about how to help people, transfers of how to transfer people safely. What else? I'm probably missing some big ones. You know, just the general anatomy, physiology piece is another big one. So range of motion, you know, just learning like these hands-on kind of activities. We also had to do a ton of public speaking, which I was never really used to. So I think pretty much they made us present consistently, I think weekly. So we were getting comfortable doing speeches and presentations, role playing if you're a certain student or you have case studies, you know, who's who, things like that. So that was a big part of our curriculum in grad school. So I think I forgot the last question. Oh, your typical day. So typical day for me is, you know, I have about, say, 10 students to see in a day. With each one of those sessions are about 20 to 30 minutes long. I might co-treat with a speech therapist for some of them. I might co-treat with a physical therapist for some of them. Generally, I'm working on, you know, we have a swing in our therapy room. They might do some sensory activities with that. We have a motor path where they have to do different activities with tape on the ground, jumping, hopping, skipping, things like that to kind of warm up, ball activities. So some kind of a gross motor ball task or something to warm up. This is COVID era, so this is what I'm doing now. Then we might go to look at their goals. So, you know, a lot of my kids are working on handwriting. So looking at individual pieces of that handwriting, can they form their lowercase a, which is a hard one for a lot of kids. So teaching them different strategies. Are we doing it in shaving cream? Are we doing it on the board? Are we doing it on an iPad? Are we doing it in the dark with a flashlight? I know, just different things like that to kind of make it more interesting to them. Puzzles, fine motor coordination activities for them, depending on their needs. Mazes, coloring, things like that, just more suited to whatever their goal is. So we pretty much will incorporate a lot of those different activities and then do a writing activity or typing. A lot of my kids are doing typing, just trying to make sure that they're keeping pace with where they need to be academically and words per minute. So we might do a lot of fine motor and typing games and things like that too. So general, that's a little more elementary. My high school kids are a little more consult, just some kids that have some more, I don't know, more physical needs and things like that. Sometimes you're just providing assistance if they need anything or a range of motion program to help them through. So I think that's about it. And then after most of those students, you know, you're just making a note saying what you did during your treatment session, how they responded, did they make progress, and just documenting your notes for the day. Also during my day, I might have to write up an IEP, which is an individualized education plan, where you have to go in, kind of talk about generally how they're performing, and then do some goals based on that of where you need to see them in a year. So every student on special ed has to be reevaluated every year on that plan. And then every 3 years, you're writing an ETR, an evaluation team report. So you're doing a more standardized assessment on those kids and seeing where their deficits are. So the IEP kind of follows that. So a lot of alphabet soup in my job for sure. So that's basically a day-to-day, but it's a good time. It's fun.
Andrew?
Sure, and I'm gonna kind of be brief. I'll leave my email address in the comments or in the chat, but I'm gonna have to jet to go see another patient here in a minute. But first couple years of PT school, it's a little bit weed out. That first semester, it's neuroscience and cadaver anatomy. So pretty much they stop you at the door. If you can't do cadaver anatomy, then it's pretty much going to be a stop there for you. That was awesome. I mean, incredible class experience, and learned so much that first summer. The whole first year is dedicated. Usually a lot of schools do orthopedics first. Great research methods, professional issues, lots of anatomy, physiology, all that kind of stuff. Usually they get you into the clinic for at least 2 to 4 weeks sometime in that first year, and then another longer clinical in orthopedics after that. And then our whole second year was basically dedicated to neuro PT, or within the neuro web of PT that usually encapsulates pediatrics. It's a lot of geriatric diseases as well. Obviously stroke, TBI rehab, which is talking about how your career changes. I came in thinking I was going to do orthopedics, found that I was so interested, I almost went to an acute care job to start, and then ended up back with the orthopedic sports realm anyway. But there's also a neurological based clinical or a neuroclinical, which is usually at least eight weeks long, depending on the school. And then you come back for some more higher level classes, radiology, differential diagnosis. For us, we had electives, learning how to manipulate spine, things like that. But there was always a focus throughout the program on research methods, professional issues, and then the nuts and bolts content of what the unit, the year was. And then usually your last anywhere between 6 and 9 months of school is all clinical rotations. So 2 to 3, anywhere between 12 to 16 week clinical rotations where you're kind of learning how to be a PT. My day to day has been limited a little bit since COVID started, but I'll evaluate and treat orthopedic and sports related injuries. We have some pretty high level technology in our clinic, so I can watch a kid throw from a pitching mound or run on a treadmill and evaluate that with the computer and look at joint angles and look at areas to make them stronger or where they need more flexible. We do a lot of concussion care here. We're tied in a little bit to the Packers, so I do a little bit of concussion care. So I'll evaluate vestibular. That's where even though I'm in sports and orthopedics now, I still have to keep my neuro a little fresh because I'm looking at kids who are getting through post-concussive syndrome. Yeah, a lot of just working out, teaching flexibility and different ways to help people care for their bodies. And that's kind of most of my day. So I have a few other administrative things I do, but I'll save that for, if anybody really wants to know that, shoot me an email.
Great. Thank you so much for attending. We really appreciate it. And we'll make sure that everyone sees your email so it doesn't get buried in the chat. AJ, do you want to keep going?
Yeah, I can talk about it a little bit. It's like I said before, it's been a couple of years since I've worked clinically. When I did work in the schools, very, very similar to what Christine described. You're doing your evaluations every couple of years, you're doing therapy. For speech pathologists, we do a pretty good mix of one-on-one therapy and then group therapy. So I might go back and forth from just working one-on-one with a child in the speech room to having 2 or 3 kids who are working on similar goals, or maybe who are working on social skills together. And then a lot of times what I would do as well is go into the classroom and do some classroom-based instruction. So I'm observing what are their communication interactions like in the classroom with their teacher or with their peers. And then what supports can I provide to make their interactions a little bit better for their academic skills or their social outcomes. But it depends, for young kids, a lot of it's play-based. We're playing games. We're really doing activities that are just getting them to talk more, to engage in interactions. With older kids, it might be a lot of drill and practice. Like, we're just going to give you speech sounds that you're going to practice over and over again, or we're going to do some explicit instruction on how to create complex sentences, or how to use new vocabulary when you're speaking. So it really depends. I mean, that's kind of what I said with, I don't understand how you could get bored with what you're doing, because you're really tailoring your instruction to every single person that you're seeing. And so part of it is just being creative and thinking about, how can I engage with this child and connect with them in a way that's meaningful for them, but in a way that's also going to target their outcomes. And then paperwork is part of it too. For every patient that you see, or every student that you see, if you're in the schools, you're going to monitor their progress. So chart how well they did on those activities that day. You're going to document it. If you're billing insurance, you've got to fill out the documentation for insurance. You're writing IEP goals or monitoring their progress towards IEP goals. Sometimes you're calling the parents to see how the kids are doing at home, maybe doing consultations with teachers to see how the kids are doing in class. And then usually your downtime is when you're spending preparing for the next day or for the next week for the kids that you're going to see on your caseload.
Great. And Mike?
Yeah, thank you very much. So I'm actually going to focus on my role as a pharmacist in ambulatory care, because I think that if I talked about my faculty role, that's cool, but maybe not what folks are interested in from a panel standpoint. One of the things that I really enjoy about being a clinical pharmacist in AmCare is just how diverse the day is, much to the description of my colleagues, right? That a typical day would be working within usually 2 different clinics within the day. So the morning would very commonly be something like a medication therapy management clinic, where you're seeing patients who are having challenges managing blood pressure or cholesterol. It's generally chronic disease states, so it can be things like depression, and really helping them maximize the dosing on their medicines, ordering labs, really everything that you'd think of in terms of what a PA or nurse practitioner might do, but that's that pharmacist role in that setting. A lot of teaching, a lot of disease education in that setting, a lot of medication education in that setting, and obviously helping modify their therapies for them to be able to get the most out of it. That role typically then also has opportunities for professional development. So sometimes you're in journal clubs where you're going through evidence-based medicine. Sometimes you're leading journal clubs where other people are relying on you to be that expert for evidence-based medicine. The afternoon would typically be a different ambulatory care clinic. It could be anything from a respiratory clinic, an osteoporosis clinic, a pain clinic, which is actually probably one of the most fun that I've been involved in my career, in helping patients with chronic pain get the most out of medications. I think it's so important when we talk about the opioid epidemic that there are absolutely safe ways to use these medications in appropriate places where they're used, and also places where they're not, and all those opportunities to help bring that practice and work with patients. Over that time, I would typically be saying somewhere in the neighborhood of 10 to 15 patients in the day within those 2 clinics. So just a lot of fun, a lot of interpersonal interaction, a lot of opportunity to serve patients directly.
Great, thank you so much. So to kind of wrap things up, I want to thank everybody, all of our panelists, for volunteering your time to speak to our students and answer questions. These events really, really help them, expand their minds about different careers that are out there. If you would like to share your email addresses in the chat, you are welcome to. If you would rather students reach out to me and I can connect you personally, I can do that as well. But to finish things off, I do want to end with the one last question we have in the chat. Basically, what is it that motivates you to be passionate about your career? You know, was there a person, was there a case, or is there something else that keeps you, you know, still going after all this time? And Christine, you want to start again?
Sure. I guess long term, you know, it was kind of that experience that I had shadowing, just seeing how the therapists work with the children, you know, in Detroit public schools where, you know, these kids don't have a lot of resources, and how she used herself creatively to kind of help them through a lot of that. And so to me, that was kind of an inspiring moment. So I thought, you know, that would be a really cool thing to do with my life. But day to day, you know, I feel like I never really wake up thinking, oh, I got to go to work, other than that first initial, like, why do I have to wake up right now? This is so early to get there when the kids do. But I mean, once I'm past that, you know, I really enjoy going there to see them. You know, like I said, I think I touched on it a little bit before, that, you know, these kids they're just so happy, you know, like some of them can have like such tragic lives, you know, their parents are lost to overdose or things like that. I mean, I work in a really small district. It's very rural, so you really wouldn't think, it's very rural and white. You really wouldn't think, oh, a ton happens, but like the diversity of my caseload as far as like the disabilities that I see coming out of there, I mean, it's really fascinating. And to see some of these kids' attitudes coming from these trauma backgrounds, or things that are happening in the home, or just general physical issues. I just think day to day, that's really inspiring, you know, just to see that. I mean, I think the news, you know, when you see on the news, like they portray so much Down syndrome, but, you know, I don't even really see too many of those children. You kind of think of developmental disability all the time as being Down syndrome. Anytime you're seeing the news, it's that. And, you know, I mean, there's so many more diagnoses that I see that, you know, really bring that light into the world. And, you know, they just are really good people to be around, and again, teach you things that you wouldn't really know about yourself. So I think just being with the students, they're just really, you know, there's always a couple that get under your skin, but if I'm being honest, but you know, it's not all joys and rainbows every day. I'll say that. But, you know, for the majority of the students, you know, I think they're very lovely and wonderful, and just bring their own amount of joy to the session. So.
AJ?
Yeah, for me, I really didn't have a special case or a special inspiration with getting into the field, but I think the experience that really stuck with me the most was my second year in my graduate program, where I did an internship in a traumatic brain injury acute rehab hospital. And I saw a patient, and I think it was the second week that I was there, who was my age, had a lot of shared interest with me. And he was there because he had shot himself in the head trying to kill himself. And he survived, but had very significant brain damage. And working with him over those next couple weeks to recover a lot of his speech and language skills. And really, he made fantastically fast progress given the extent of his brain damage. But I think realizing like, oh, this, you know, he's the same age as me, he has the same interests. Like there are people who are like me who are struggling to communicate. And, you know, I can't imagine what it would be like to not be able to communicate, to have your voice completely taken away. And so that really changed the way that I think about the services that I provide, with how crucial it is that people have a voice, that people have the ability to communicate their wants and needs and feelings. And so I think that has always stuck with me.
Yeah, I think that from my standpoint, you know, similar to AJ, I wouldn't describe it as any one single, you know, moment. I'm certainly think that faith is really important, and one aspect of that is that you're given your gifts for a reason. And I think it's really important when you're working with patients to be their advocate And that's really what I think drives my passion for the profession. There's a lot of times you're working with patients where you're seeing a problem and you say, you know, if I can see the opportunity to fix it, but I don't, right? That's really a mistake and a lost opportunity. So there's a lot of our jobs, I think, that really fall into the if not me, who, and if not now, when. And that drive to be there for another human being just really helps maintain that passion. Christine did an awesome job of highlighting not every day is rainbows, right? It's not all roses. And there are absolutely moments where it's hard to remember but if not me, who, if not now, when. But if that sticks with you most of the time, I think that it's reasonably straightforward to be able to keep that passion and keep that energy for getting up and serving others.
Great, thank you so much. I want to thank you all again for always being willing to work with our students and help our students. I do also want to add thank you, Allie. She was an assistant student to me and we had some technological issues, so she took over for a little bit. But students in attendance, if you have any more questions, feel free to reach out to our panelists. And thank you so much. Everybody have a great night.
Thank you.
Thanks.
Thank you.